I've been lucky enough to be involved in a breast examination project where I've been designing some medical mannequins. This video is talking about refining the language of touch when you're teaching clinical breast examination. So breast examination remains an important skill in medical education, and really what's required is the student to identify and discriminate between different masses. So they need to know what's normal and what's not normal when they're doing a breast examination. So we've made these realistic mannequins here, and we interviewed a number of breast specialists about their experience and the language they feel when they're doing a clinical breast examination. Our hands are multi-sensory and they're very sort of complex, but you can't see what's happening inside the breast. So if there are shapes there which are normal breast shapes and they're supposed to be in the breast, then you need to be able to feel what's normal and what isn't normal. Ribs are supposed to be there, other bits and pieces. But what's not supposed to be there are things like a cancer or a cyst is not supposed to be there. You can't see these objects, you have to feel them with your fingers. And you do this by palpating and having the object underneath. So when the breast specialists feel, they need to communicate this skill to the students, and that needs to be done verbally. So the students have to determine what is a different lesion. They need to know what's soft, what's hard, what's smooth, what's regular in shape, what's irregular. And some of the things are okay and some not. So a smooth shape is okay, and an irregular shape like a cancer is not an okay shape. If it's tethered, so that means it's stuck here somehow, that's a bad sign. If it's mobile and moving underneath, that's a good sign. And all of these can be demonstrated inside of the model. So we can put underneath the layer of skin and fat and nodularity that's inside of our model, we can put these different shapes onto the rib cage that you can't see there but looks like this underneath there, and you can feel. And this gives you an idea of the communication, so everyone's talking about the same language. Thank you very much for listening.